Howdy, my future doctors. Hope you guys are doing good. And we were discussing about erythropoiesis, right? So, in the previous video, we have discussed about how the first and foremost, most important component of erythropoiesis, iron, is taken into the system and how it is transported to the blood and later into the bone marrow so that we can produce RBC, right? So, in this video, we are going to focus on the other key components and also the steps of erythropoiesis, how the erythropoiesis is being taken place and which are the stages of erythropoiesis, which are the type of cells we come across, and also the features of those cells. Okay, and we'll discuss the clinical aspect, the anemia, polycythemia, etc. In another video. Okay, so in this video we're going to discuss the other components or the other factors of erythropoiesis and the erythropoiesis itself. Now this is what we discussed in the previous video, and I think I will not go through this once again because we've already covered this, and if you want to know more about this, watch the previous video. Okay, now then coming to erythropoiesis once again, what are the major factors which will help in erythropoiesis? First one is of course iron. We have talked about this, and there are certain vitamins, right? There are certain vitamins. Which are they? Vitamin B12 and vitamin B9. This is B12 is cyanocobalamin, and this one is folic acid. Okay, right? And there is a very important hormone which is EPO. Okay, and it is majorly produced in kidney. Okay, wait a minute. What is EPO? EPO is erythropoietin. EPO is erythropoietin. Okay, let me just. Okay, so iron is there. We've discussed about this. Vitamins are there. We're going to discuss about that. And EPO or the erythropoietin, we're also going to see about erythropoietin. So then for the RBC production, the main component, hemoglobin, needs two parts, right? Which are they? Hemoglobin needs two components. One is heme and the other one is the globin. So for the production of globin, we need amino acid. For the production of heme, we need majorly iron. But there are also involvement of carbohydrates, and also what? Fatty acids. So carbohydrates are there, fatty acids are there, amino acids are there, iron is there, vitamin B12 and B9 is there, erythropoietin is there. So these are the major factors, okay, which are contributing to the production of erythrocytes or RBCs or red blood cells, whatever you call that. Okay, so now let's just focus about this B12 and B9. We can come back to this little diagram, and here there are two major sites, okay, of intake of these two vitamins. First one is this part, which is ileum, and the second one is duodenum itself. Okay, so we can first talk about the factor which is in the duodenum, okay, which is vitamin B9 or folic acid. Okay, so this folic acid is also entering to the system or entering to the bloodstream through the duodenal lining. Through which cell? Enterocytes. Okay, so you might have wondered what is this transporter here doing when we discussed about the iron transport last time, right? So this is through where the vitamin B9 will enter the cell. Okay, and it has certain transporters which can move this B9 out of the cell and to the circulation. It is not that much important how the B9 is transported, but there is another major, very important vitamin, which is vitamin B12. Okay, this vitamin B12 is not absorbed through duodenum. Instead, it is absorbed mainly through ileum. Okay, and vitamin B12 as such cannot be transported into this like cells of ileum. Okay, so you need a transporter or something which facilitates the transport of B12 to the system through the cells of ileum, right? So what is this transporter or what is this facilitator? It is intrinsic factor. This is what? Intrinsic factor. So where does it come from? Intrinsic factor comes from the parietal cells. of stomach. Now, of the GI tract, we have mentioned three major portions where this absorption or the involvement of these portions are very important. So, first one is duodenum, through which folic acid and iron is taken into the system, and the second one is ileum, from where the B12 is taken into the system, and then parietal cells of the stomach, okay, which will produce intrinsic factor, which in turn helps the transport of vitamin B12. So, how does this process happen? So this process, basically what happens is, if you take this like round shape here as vitamin B12, the intrinsic factor will bind to the B12. Okay, this is intrinsic factor. So this intrinsic factor, and what happens is it goes to the ileum, and there will be this cell, okay, and there will be this receptor, okay. So this complex will go to the cell of ileum, and you can see this shape here and this shape here are similar. So it will receive, or it will be what do you say, it will respond to this intrinsic factor B12 complex. So this intrinsic factor and B12 complex will go and attach to, let me get this arrow out of the way, and attach to this receptor, okay. And now what happens? Now what happens is receptor mediated endocytosis. Receptor mediated endocytosis. It is also known as the clathrin mediated endocytosis. There are some proteins here called clathrin which will form a vesicle, which will endocytose and form a vesicle inside the cell, blah blah blah. It goes on like that, okay. So this is the receptor mediated endocytosis, through which this B12 will get inside this cell, okay. There will be a vesicle, and there will be our intrinsic factor and our B12, okay. So from this vesicle, this B12 will detach from the intrinsic factor and go to the bloodstream, okay, to blood, okay. So this is how these two key components reach the blood and later to the bone marrow, where the erythropoiesis takes place. Now, before discussing EPO, let's just talk about the steps of erythropoiesis, and we can like come from there back to EPO, or the erythropoietin, okay. So what happens is, in the system, in our body, there are certain cells, okay, there are certain cells which has the ability to divide and differentiate into any type of cells, okay, any lineage of cells. And among this, we are going to discuss about the pluripotent hematopoietic stem cells, okay. So what is it? Pluripotent hematopoietic stem cells. So pluripotent stem cells are the cells which can multiply and differentiate into any type of cells, in the future. And here it is the pluripotent hematopoietic stem cells, which means this stem cell can divide and differentiate into any type of blood cell, okay. Let it be RBC, let it be any type of WBC, monocyte, lymphocyte, granulocyte, anything. And also platelets are also produced from this pluripotent hematopoietic stem cell. So if we take this pluripotent hematopoietic stem cell, what are they? They are multi-lineage cells, okay. They can form any lineage. Now they will form two major lineages, okay. These are myeloid stem cell, myeloid stem cells, and lymphoid stem cells, lymphoid stem cells. Okay, I'm just putting SC for stem cells. So these are called the stem cells, right? Now we are not interested in this lymphoid stem cell that much at this moment, at this point of time. We can talk about this myeloid stem cells more, okay, which is more important for us. So the myeloid stem cell is also what? Multi-lineage stem cell. Okay. So this multi-lineage myeloid stem cell can give rise to a colony forming unit, a CFU of MGE. That means this CFU or colony forming unit can turn into either a megakaryocyte or an erythrocyte. Okay. So this is called a multipotent progenitor cell. Multipotent progenitor cell. Okay. So then from this multipotent progenitor cell, we'll get blast forming unit, erythroid blast forming unit, and erythroid colony forming unit. Now if you see, there is only erythroid. Okay, so what does that mean? It will form erythrocyte. So these are progenitors, but what are they? Common or unipotent progenitors. Unipotent progenitors, right? Okay. Now what makes the cell to decide, okay, I'll form this, I'll form an RBC, or I'll form a WBC, or I will form a neutrophil or a basophil? What decides that? It's not like the cell is hanging out and it decides suddenly, okay, today I'm going to change into an RBC. No, that's not what happens. There's an influence of a certain chemical, okay, a protein, which will help in deciding what you should form. Actually, there is not one protein or one chemical which helps in this process. There are so many other factors which influence in deciding which lineage it should follow. Here we are talking about what? Erythropoiesis, RBC. We are only worried about RBC production, right? So here the case is erythropoietin. So erythropoietin decides how this whole play will turn out to be, okay, whether to synthesize RBC or not. It is the directing factor. So it will help in the formation of the normoblast cells or pronormoblast cells from this blast forming unit or the colony forming unit, or from the multi-progenitor cells. Okay, that is the function of erythropoietin. So from where this erythropoietin is coming? It is from the kidney. Only from the kidney? Huh? No, it is also coming from liver, but the major site of production is kidney. But in kidney where? You should be specific about that. Okay, the interstitial cells of peritubular cells. Peritubular cells. Okay, it is from the interstitial cells of peritubular cells. So these cells in their DNA, okay, in their DNA contains a specific gene. Okay, this gene is EPO gene. Okay, EPO gene. And this gene on transcription will produce erythropoietin. Okay, the EPO gene on transcription produces erythropoietin. But for this transcription to happen, there should be an influencer or a factor which helps in this transcription. That factor is this HIF, or the hypoxia inducible factor. Hypoxia inducible factor. So as the name suggests, it's hypoxia inducible. So it will be induced by hypoxia. But how? Normally in the cell, the HIF is inhibited by an enzyme or an inhibitor, okay, which is asparginyl hydroxylase. So this inhibitor inhibits, or it is like holding the HIF to itself. Okay, so this asparginyl hydroxylase is not letting the HIF to go into the nucleus and transcribe and produce EPO. Okay, transcription, translation, and produce EPO. So this transcription is not happening because this HIF is inhibited by asparginyl hydroxylase, and you can see it is hydroxylated. That means OH groups are there, okay, to this inhibitor. But when there is no oxygen, there will be no OH group. Okay, the hydroxylation will not happen. So what happens is this inhibitor in turns get inhibited by hypoxia. So hypoxia will inhibit who? The inhibitor. So what happens to HIF? HIF will be free, and it will help in the transcription, translation, whatever. Okay, transcription, the step is transcription. It helps in the transcription to produce EPO. Okay, the gene will transcribe to mRNA, and that mRNA will translate to EPO. So HIF, you should remember about HIF and the inhibiting factor, which is removed by hypoxia. So hypoxia is the major or the main factor for the production of RBC. Okay, if the teacher asks you what is the major stimulus for RBC production, you not say like bleeding or EPO, nothing. The main factor or the main stimulant for the RBC production is hypoxia, and this is how hypoxia is influencing the RBC production by producing enough erythropoietin. Okay, so that's, now let's just come back to this cellular lineage. Okay, the flow chart we were talking about. So from the CFUE or the colony forming erythroid colony forming unit with the help of erythropoietin, it will form certain cells. Let me draw that in blue. Okay, these are the pronormoblast or proerythroblast. Now we are talking about the blast cells. Okay, pronormoblast or proerythroblast. So as you can see, it is a very large cell. Okay, like 15 to 20 micrometers in diameter, and it is a dark and basophilic. So what do you mean by basophilic? Basophilic means the cell itself or the component itself acidic, and it has the affinity towards a basic dye. So that is basophilic, something which loves base. Okay, so it has a dark basophilic cytoplasm and the central nucleus. Also we can see like 2 to 5 nucleoli within this nucleus. Okay, and the chromatin is somewhat clumped. Now from pronormoblast, if you go or move forward, we'll go to another cell, another blast cell, which is the early normoblast. Okay, early normoblast. Blast. Okay, early normoblast. So as you can see, the size have shrunken a little bit. Okay, so it's like around 12 to 18 micrometers in size. It is also rounded. So why are we talking about rounded? We'll see at the end what the shape of the final cell. Okay, and the cytoplasm is basophilic. Here it was what? Basophilic. Here also it is basophilic, but it's somewhat less basophilic than the pronormoblast. Okay. Now the next cell, which is even smaller. Okay, oh, I forgot to mention here, are you seeing any nucleoli? No, right? There's only some covers, chromatin fibers are there. So there are no nucleoli. Here it is called the intermediate normoblast. So this early normoblast is also known as basophilic normoblast. Okay, so philic normoblast. So if you will see terms like basophilic erythroblast, it's the same thing. Okay, instead of normo we'll just use erythro. So now coming back to this one, the intermediate normoblast. So the intermediate normoblast or polychromatic normoblast or erythroblast. So this intermediate normoblast or polychromatic, what do you mean by polychromatic? Now in the previous cell we saw it's basophilic. Why? The cytoplasm has some acidic components. Okay, it's because the cells are producing RNA, and this RNA is acidic, and this RNA will take a basic stain which makes the cytoplasm basophilic. But when it comes to intermediate normoblast, there is the appearance of hemoglobin. It is very, very important. Here is the appearance of hemoglobin. In which stage? In the polychromatic normoblast stage. So hemoglobin, which color is hemoglobin? It's red, right? So the cytoplasm will have a red color and basophilic, blue color. Okay. So the cytoplasm will have more than one color. That's polychromatic. Okay, so that will form a polychromatic normoblast. Now you can see the cell is again what? Smaller, like 10 to 15 micrometers. So you see the trend here, right? The cell is becoming increasingly smaller, and also the nucleus is also becoming increasingly smaller, and the nucleus stays, like the chromatin fibers stay somewhat coarse, and there is no nucleoli anymore. Okay, so coming to the next stage. So here in the intermediate normoblast, what is the main important part we mentioned? Hemoglobin appearance, the first appearance of hemoglobin. And from the polychromatic, it will come to this orthochromatic or normoblast or late normoblast. Okay, so it is also round, but the nucleus is shrunken very evidently, and it is eccentric. Eccentric means it's like shifted from the center of the cytoplasm towards the periphery. Okay, here if you see this nucleus, you will be a bit confused, so we'll make it like that. Okay, so the nucleus is eccentric, also partially extruded. That means the nucleus is being expulsed or being thrown out of this cell. We are getting rid of the nucleus. Not only nucleus, also mitochondria. Okay, and some of the other cell organelles as well. So we can see, and the cytoplasm is rich in hemoglobin now. The hemoglobin is really high. So from this orthochromatic stage, we'll go to the next stage, which is, and the cell obviously have become smaller, like 7 to 12 micrometers. Okay, now when we see, there will be these cells, reticulocytes. So these reticulocyte has reticular cytoplasm. There will be fibers in the cytoplasm, or the reticulate appearance of the cytoplasm, which is the reason why we call it as reticulocyte. Okay, that's obvious, of course. But this reticulocyte have a very important clinical aspect to it. If you would see, the reticulocytes which are like transported to the bloodstream or the circulation from the bone marrow, okay, through the sinusoidal capillaries. Okay, so the reticulocytes are transported through the sinusoidal capillaries to the main circulation, and in the circulation these reticulocytes will turn into what? RBC. Okay, our beloved RBC. We were trying to like make this thing for a long time, right? So this is what happens. So if you check how much of these reticulocytes are present, it will indicate how effective our treatment against the diseases like anemia is due to low RBC count or low hemoglobin count. When an anemic patient approaches you and you find out the cause and you try to avoid that factors and treat the patient to assess if our treatment is going in the right direction, is there any improvement in the condition of the patient, we'll check for the reticulocyte count. Now coming to the RBC, the final one, there is no nucleus, there is no mitochondria, and the cell is circular, it is discoid in shape. And this discoid shape will help in many function of this RBC. It will increase the surface area, it will increase the osmotic fragility, it will increase the flexibility or the deformability of the RBC. So there are many factors to this discoid shape. And if you think about it, what is the function of RBC? The major function of RBC is to transport oxygen, right? So the absence of mitochondria will help this RBC in the transport of oxygen. What happens in mitochondria? Aerobic respiration. For aerobic respiration, what do you need? Oxygen. So if there is mitochondria and there is oxygen in the cell, some of the oxygen will be used for the aerobic respiration of RBC, right? So by removing mitochondria, we are reserving that oxygen for the transport sake only. Okay, and we have already talked about this vitamin B12, vitamin B9 and iron. Okay, in which step are these components are important? If you will see, Fe2 plus ferrous form of iron is essential for the production of hemoglobin, and folic acid and B12 are required for the maturation and condensation of DNA. Okay, so if there is no B12 and folic acid, there will be no maturation and there will be no condensation. So without maturation, the cells will go into the bloodstream. Without maturation means the cells will be large in diameter. Okay, the RBC is 7.8 micrometer on average, but look at these cells, the early normoblast, it's 12 to 18 micrometer. And when we look at the blood picture, we will see larger cells. Okay, that's the megaloblastic anemia, which is very important. Okay, we'll discuss about the different type of anemias in another video. And if there is no iron, what happens? There won't be enough hemoglobin. So what is that? Iron deficiency anemia. Iron deficiency anemia is the most common anemia which is seen in Indian population. Okay, which is very important. So this is almost everything about this erythropoiesis. This is how the RBC is produced in our body. What's the site of RBC production again? Red bone marrow. Red bone marrow. So that's it. We have successfully completed the first topic. Thank you guys for sticking with me, and we'll see in another video. Bye bye.